Hey ladies, Breeanna here. Happy Breast Cancer Awareness Month, and I thought what better way to celebrate the month than to promote your own breasts and how we should be taking care of them. So this is your little tutorial on the best way to give self breast examinations. So first of all, there's a few tips that you might want to do prior to just jumping in if you don't already do them, which you should. But things to keep in mind. Number one, you do want to make it routine. So this is something that you do regularly. Breastcancer.org, which is where I got this information today, recommended that you always do your breast self-examinations after your period. That way your breasts aren't as full or as engorged, and you can certainly feel the actual breast tissue. Number two, get to know your breasts. You should touch your breasts a lot because everyone's breasts are a little bit different, and a lot of breasts have natural like little lumps and bumps in them, whether it's your mammary glands or just the way that the tissue is built. So get to know your breasts, because what you're looking for are specific changes in your breasts or things that just aren't normal. We're going to talk about that. So get to know them. A lot of women do have little bumps up here in their armpit, and that's going to be a lot of your lymph nodes. So, natural little lumps and bumps, that's generally pretty normal. Some women on the bottom side of their breast, it might feel a little bit more like sandy, a little bit more like a beach. Some women might have lumps behind the nipples that are like more like little grains of rice. And then some women just have kind of lumpy breasts, so that's normal, if that's normal for you. So we recommend, or breastcancer.org does recommend, that you start a journal. Get to know your breasts. This is what they feel like today. This is what they feel like next month. This is what they feel like 2 months from now. Because what you're going to notice if there are changes. So if your breasts always have those little lumps and bumps in those same places, cool. Number 3 tip, don't panic if you do find something, right? Just take note of it. And note if it goes away, or if it continues to change, get bigger, get harder, get lumpier, so on and so forth. So document any changes that you have, but don't panic yet, okay? And number 5, when you do notice things that are changing, definitely talk to your doctor about those. Be like, all right, so this lump has been there for 2 months now, it's not moving, I feel like it's getting a little bit bigger. That's when you certainly want to make sure that you go in and see a doctor and you get special attention to those changes. So how do you actually want to perform your self-breast examination? So once you have made it a routine, the actual exam itself should also become more routine. So first of all, you want to look at your breasts. So before you even touch them, you just want to look at them. So stand in front of a mirror, put your hands on your hips, and look. Are they your normal average size, shape? Is there any tenderness, swollenness, coloring? Is it all normal for you? And you don't know what's normal for you until you've made this a routine. So you got to know what they look like. So look at your breasts, right? Putting your hands up on your shoulder, it gives you an opportunity to see if they're level, level, and what they look like. So what you're going to pay attention to is, again, changes. So is there any dimpling that's happening on your breast, in or around your breast? Is there any puckering, any bulging, any distortion, any abnormal coloring, any abnormal swelling? And then also notice if your nipple has changed positions. Has it become inverted? Is it in a different place? Is there any soreness or redness, any rash that has developed? Those are things that you're just looking for before you even touch your breasts. Once you have now looked at your breasts, change the position of your arms, right? Bring one arm up, and again, look, has anything changed? Again, dimpling, bulging, swelling, and you're looking for a lot of the same stuff. Additionally, you want to notice if there's any abnormal fluids coming out of your nipple. It can be watery, it can be milky, it could be yellowy, it could even be blood. That's also things that you want to pay attention to. Now, of course, if you're breastfeeding, a little milk lactation, that's probably normal for your breasts at that time. But if you're not, that is something you want to pay attention to. So once you've stand in front of the mirror, you raise your arms like a Wonder Woman or Shiva, I don't know. Anyways, you want to go ahead and do it lying on your back as well, because when you lie on your back, your breasts are now relaxed. And this is actually when you want to start touching your breasts. Again, so you want to know what is normal for your breasts. Breastcancer.org recommends that you take your hand, use the pads of your hands right here, and you're going to start right up in your armpit. And there's a couple of different ways that you can actually perform your self-breast exam. So you can start in the nipple and work your way out in a circular motion, or you can start in your armpit and kind of work your way down and around, right? Additionally, some women prefer to be kind of more like a picket fence where they're going up and down, up and down, up and down, all right? And that's how you want to check your breasts. And you want to check your entire breast. So you want to check it all the way from inside your armpit, because you do have breast tissue that goes up in here. And this is also where your lymph nodes are. And then you want to go all the way down to where your breast tissue hits your abdominal, and then all the way up into your collarbone as well. So all of this is your breast tissue. So you want to check it all. So however you decide that you like to do your self-breast exam, you just want to make sure you continually do it that way. Make it a routine. So start in the armpit, come all the way around, and you're doing it in small circular motions, all right, just like about the size of a quarter. And again, things that you're looking for is things that are abnormal for your breasts. So if you feel kind of a moving, lumpy, oatmeal-y thing, and that's always there and it's always been there, you're probably fine, right? But if all of a sudden you're going around and you feel something that's like a little rock, it's hard, it's immovable, or that it has grown in size, that's something that you want to pay attention to. So once you've started your breast self-exam, lying on your back, breastcancer.org also recommends that you stand up and do it while you're standing up. And again, it's just because the breast tissue is going to be lying in a different way, in a different position. So you just want to make sure you check out all of the breast tissue. So everything, again, from your collarbone to your abdomen, from your armpits, all the way into your cleavage, because this is all breast tissue. Some women do recommend that they do their self-breast exam standing up in the shower, because the way their hands are a little soapy, and so it's a little bit easier to manipulate the tissue. And when you are checking your breasts, light touch, medium touch, and then the deep tissue touch as well, because your breasts are large, so you want to make sure that you get all the different layers of that breast tissue, and you just want to feel them. So I hope this is your reminder to check out your breasts. This is October. This is Breast Cancer Awareness Month. Of course, you should be doing this monthly. And get to know your breasts, ladies, because they're awesome.